We want to better understand the barriers that marginalized young people living with a mental illness experience accessing digital information, research, and communication technologies. Youth are very much connected to the internet, more than any other generation. However, not all young people who are living with a mental illness have the same access to the digital world. So we are interested in understanding this digital divide among housing insecure, LGBTQ2 identified, and racialized youth.
There will be 5 outcomes of this study: a review of the literature, a qualitative study to explore barriers among marginalized youth, a Delphi consensus exercise to create a list of ingredients that are considered important by youth and young adults, face-to-face meetings to use this information to co-create a digital literacy curriculum, and finally, a study to pilot test the digital literacy curriculum at 2 Foundry centers in British Columbia.
Foundry is a network of one-stop shops for youth to access primary care, mental health care, substance use support, peer support, and social services. Today, 7 centers are operational and 4 more will open in the near future. Foundry also provides an online service intended to facilitate virtual navigation, e-mental health services, and peer support. Foundry is now highly visible in BC and is a symbol of hope, where youth and families can receive rapid access to care while decreasing stigma.
As a youth mental health researcher, I'm really excited to work in collaboration with our youth research members and youth peer interviewers to co-create research.
We are excited to work on a project that will have an immediate impact on health services in British Columbia. With our Foundry partners, we can implement our findings quickly and continue to build a culture of youth-centered research in the province.
As someone who has accessed online mental health services and now builds online mental health services, I want to know how we can make online mental health services as accessible as possible to everyone who wants to use them. What infrastructure to access these services is needed? Is it the case that young people experiencing the digital divide have no access to technology at all? Or do they have access to older technology that doesn't have a data plan? I'm excited for this work to help us answer these questions so that we can build the best and most accessible online services.
And what really excites me about this project is that it looks to explore and to better understand the social inequities that may exist among youth living with mental illness when it comes to accessing technology and digital information, and then to be able to use this information to better inform potential future Foundry projects.
This project will raise awareness of the importance of and benefits that come from patient-oriented research by training graduate students and youth peer research partners from across BC and engaging 3 Foundry youth leads in the development and implementation of this project. We will also publish a paper on advancing patient engagement methods among marginalized youth with mental illness.
Youth were involved in the development of the proposal and will be involved in all stages of this project. Our 3 youth partners will help co-develop the interview scripts and co-lead interviews, help interpret the results, and co-lead knowledge translation activities such as World Cafes.
What excites us about this project is the bringing together of researchers and youth experts to advance mental health research for youth.
The BC Support Unit Methods clusters are really approachable. The mentorship is unprecedented, and I am thankful to work in an environment that is supportive and open to pushing the boundaries of science and innovation.
As a young person with lived experience who now works in the field, I appreciate this project's ability to bring together some awesome brains to solve tricky problems. Having many different experiences and perspectives and understandings of technology at the table gives us the opportunity to make something really, really awesome together.
Digital health technologies are an important part of the future of mental health care. It is critical that young people, specifically young marginalized people, are involved from the beginning to research and design a system of care that works for them.
We are honored to co-lead this work with youth partners in British Columbia, and we look forward to supporting the health system reform and the advancement of scientific methods for effective patient engagement. We're also grateful to Sandra Dawson, who spearheaded the development of an earlier version of this Digital Divide project in collaboration with the Mental Health Commission of Canada.